If you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
Look at your calendar! See what date it is?
I see. It's the 17th of August.
Yes, but it's not just the 17th of August. It's Saturday, which means it's time for the Maria Holder Diabetes Radio Show on VOB 92.9 FM. 15 minutes of diabetic-friendly, healthy information is about to come through your radio that is especially designed for diabetics and pre-diabetics, brought to you with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the bank that is there for you, Republic Bank.
And how much are they there for me?
Well, that's a good question. Here's the answer.
Dream a dream and watch it become a reality. You can do anything. Pull up a chair, come sit and come share with Republic Bank. You can do anything. Yes, we're the one for you, making dreams come true. We're the one for you, your partner for life. We're the one for you, Republic Bank.
Republic Bank, the bank that is there for you, combining efforts with the Barbados Diabetes Foundation every single Saturday to tell you all about the Maria Holder Diabetes Center, the place to go for all of your diabetic needs. Good morning, this is Peter Boyce here, but don't take it from me. Listen to what Mildred has to say.
I don't let nobody run my blood to water. When it comes to the best diabetes services, I know where to go. Up behind Eunice Gibson Polyclinic is where you can find me. At the Maria Holder Diabetes Center, getting my eyes checked for diabetic retinopathy. Because I just do that every year. A year does not miss me. You see how pretty my eyes is? Well, I want to be able to see out of these pretty eyes. I's a hot gal, so I never miss a year that I don't get checked for diabetic retinopathy. And then I got vascular services. You can check to see if you got bad circulation. And then they got diabetes doctors like Dr. Diane Bradford. Dr. Diane, how are you? I ain't heard you this morning yet. And then I got nurses like Nurse Tracy, who you gonna be hearing from soon. All of these peripheral services you can find at the Maria Holder Diabetes Center. And what I love is the price. Greatly reduced prices so everybody can afford to go to the Maria Holder Diabetes Center. You can't say you ain't got the money because the prices reduce. The people want to hear the telephone numbers to make an appointment, please.
Thank you, hot gal Mildred. I got a song coming up for you special, so keep listening. The numbers to call to make an appointment with the Maria Holder Diabetes Center. Get something and write it down. 243-3937 or 417-0305. We are going to give those numbers again before we are finished. But right now, we are going on to our first topic of the day. This morning, we are going to focus on medication. You go to the doctor prescribes you medication and you take it, but you don't really know about it and you don't really know what it can do for you. Well, Nurse Tracy Bushell is here this morning to focus on what different medications can do for people who are diabetic. So let's say good morning to Nurse Tracy.
Good day, everybody. My name is Tracy Bushell, diabetes specialist nurse from the Maria Holder Diabetes Center for the Caribbean in Warrens. Over the next few weeks, we are going to share information on different tablets used for the treatment of type 2 diabetes. Today, I'm going to talk about metformin, which may also be known as glucophage or glyformin. Metformin targets insulin resistance, i.e. making the body more sensitive to insulin. Insulin resistance is a feature of type 2 diabetes and can be present in pre-diabetes, people with type 1 diabetes who are overweight, and with polycystic ovary syndrome. It is used first line for the treatment of type 2 diabetes as per local and international guidelines. It's been available for many years and has an excellent safety profile. Sometimes gastro disturbances, i.e. diarrhea, can occur when taking metformin. However, most people tolerate it well if it's taken correctly, and the dose can be adjusted to suit each person. Any issues with side effects, of course, should always be discussed with your doctor. Starting the medication slowly is key, and perhaps with just one tablet at 500 milligrams once a day with your main meal. It's very important to take it with a meal and titrate the dose slowly on the advice of your doctor. And I always advise my patients to take it halfway through their meal so it's actually digestive with their food. A slow release preparation is also available to ensure persons can tolerate it well. And the effectiveness of metformin is often quite amazing. And for those people that are very metformin sensitive, it's actually quite incredible how blood glucose levels escalate if it has to be stopped for any reason, which demonstrates its effectiveness on blood sugar levels. For most, you would expect to see a drop of just over 1% in your HbA1c blood test once metformin is started. It also works well in combination with other diabetes medications and is available as a combined preparation for some, which keeps the number of tablets down. Other benefits of metformin can be weight loss, cardiovascular protection, and i.e. the heart. And with pre-diabetes, evidence suggests it helps with the prevention of going on to develop type 2 diabetes, particularly in the very overweight population. It's been proven to be safe to use in pregnancy, albeit gestational diabetes or existing type 2 diabetes. It helps to prevent excessive maternal weight gain, less insulin requirements, and fewer large babies, which in itself can present issues for the newborn. For those persons who have polycystic ovary syndrome, it can help with the restoring of ovulation and a regular menstrual cycle, thus reducing the risk of going on to develop gestational diabetes in pregnancy and also the risk of miscarriage. Some people are led to believe metformin can cause kidney disease. In fact, this is untrue. However, metformin should be used with caution or stopped in the presence of declining kidney function. Something called an EGFR would be assessed by your doctor, and metformin may be reduced or stopped altogether depending on the results of the test. Less common is a vitamin deficiency, particularly vitamin B12. This is why it's important to attend a review with your doctor on a regular basis, who will perform screening tests at intervals throughout the year. For acute illness and possible hospitalization, metformin may also need to be stopped temporarily, plus other diabetes medications, and a possible temporary switch to insulin until things are stable and the illness has subsided. This is purely for safety reasons to ensure kidney function is normal, and it can be restarted often within as little as 48 hours. In summary, metformin is a very effective, safe medication for the treatment of type 2 diabetes and other conditions mentioned. As also stated, any concerns or questions should be addressed with your doctor or healthcare provider. Look out for the next program expanding on other diabetes medications.
So thank you, Nurse Tracy, for that important information on medications, and we look forward to hearing more from you in the coming weeks. Now, ladies, I have a question for you. Do you know what can make you beautiful?
I know. Botox.
No. What can make you naturally beautiful and healthy at the same time is water. Good old-fashioned Bajan water. So we are going to go to the General Manager of the Barbados Diabetes Foundation, Miss Marsha White, to let you know some more about how water can make you beautiful. Not Botox, water. Good morning, Marsha.
Good morning. Today I'm talking about water, and something that you might not know is that water is your skin's best friend. So imagine your skin cells as tiny water balloons, and when they're plump and hydrated, your skin looks radiant and healthy. But when they're dehydrated, well, that's when you notice dryness, wrinkles, and dullness. So here's the science behind it. Water helps maintain the skin's natural moisture barrier. It helps your skin be flexible and resilient. It also flushes out toxins, which can lead to breakouts and other skin issues. So if you want that youthful, glowing complexion, and I'm probably talking mostly to the ladies here, make water your go-to beverage. And don't forget, while skincare products are helpful, true skin health starts from within. So stay hydrated and stay beautiful.
Okay, thank you, Marsha. Thank you for that good water information. Okay, ladies, you've been drinking all that water and you're beautiful and you're hot, which leads us into our song of the day. A big song from Crop Over 2024 that tied with second place with Lil Rick in the Tune of the Crop for this year. This is Hot Gal of the Year, Tiana Hernandez with Starter Pack. Compliments the Maria Holder Diabetes Center and Republic Bank.
If you're sexy and you know it and you ain't afraid to show, your body look nice, you better bubble it right. If you're sexy and you know it, put your hand in the air. Wave your flag and show them who's the hot gal of the year. Hot gal coming through, show me what you can do. Send the bodies in the crew, show me what you can do. Hey gal, you're too slack, bend your back and you don't look back. Tell me what's in your starter pack. I want to walk up my waist like that.
The Maria Holder Diabetes Center.
Break it, gal, bend down and show them who's the hot gal of the year. Gal, bend down and shake it, shake it, shake it, shake it. Raise your flag and show them who's the hot gal of the year. Gal, squat, you know you're looking hot. Good knees, bounce it if you please.
The Maria Holder Diabetes Center.
In your back, a big, big food steam veg and stew. Gal, show me how to do that. Make the bumper clap. Gal, show me how to do that. Make it, make it. Gal, bend down and shake it, shake it. Bend your back, don't break it. Gal, bend down and show them who's the hot gal of the year. Gal, bend down and shake it, shake it, shake it, shake it. Raise your flag and show them who's the hot gal of the year. Gal, bend down and shake it, shake it. Bend your back, don't break it. Gal, bend down and show them who's the hot gal of the year. Gal, bend down and shake it, shake it, shake it, shake it. Raise your flag and show them who's the hot gal of the year. Bend down and shake it, shake it. Bend your back, don't break it. Gal, bend down and show them who's the hot gal of the year. Gal, bend down and shake it, shake it, shake it, shake it. Raise your flag and show them who's the hot gal of the year.
The Maria Holder Diabetes Center.
It's time we heard from someone who has experienced the excellent services of the Diabetes Center firsthand, Mr. Henderson Brewster. Henderson, how long have you had diabetes?
31 years.
Tell us about your experience with the Maria Holder Diabetes Center.
To me, they're helpful. I ask a lot of questions and I get all the answers I want. It's like, I get information. I ask questions and I get information.
Did you find the staff receptive to all your questions?
Of course, yes. The doctor and the nurse.
And the advice you got from the Diabetes Center, did it help you to cope with your diabetes?
Of course, yes. And not only that, but they do lots of like blood work and stuff like that. And keep me on track. You know how the body function and keep me on track.
So will you recommend persons who are listening visit the Diabetes Center?
So far, what my information is best to do that.
For over 10 years, the Maria Holder Diabetes Center has been effectively serving the diabetic and pre-diabetic community of Barbados with a range of international standard health services, which include diabetic eye screening, vascular screening, nutritional advice, and consultations with diabetes specialists. So if you are listening to VOB right now and you have a diabetic related query or you need to make an appointment, you can call 243-3937. You can also follow us on Facebook or Instagram. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program, Republic Bank, and the Maria Holder Diabetes Center celebrating its 10th anniversary.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937.
Dream a dream and watch it become a reality.